My name is Nathan Mitchell, and at 32, I became the youngest chief of surgery at Boston Memorial. Growing up with a chronic kidney condition meant countless hospital visits and multiple surgeries. My sister Amanda was always my mother's golden child, while I was the burden. When I was 18, Mom delivered the crushing blow. Your sister's graduation is more important than your surgery. 10 years of silence followed as I built my career from nothing. Then fate struck when my sister walked into hospital orientation as a new hire, and there I stood at the podium. Before I tell you how I handled seeing my sister's shocked face after 10 years, let me know where you're watching from, and hit that subscribe button to join my journey of healing and success. I grew up in a modest home in suburban Boston, a place where neighborhood kids played street hockey and dreamed of being the next Bruins star. For me, though, those dreams were replaced early on with something more serious. My father, Robert Mitchell, was my hero from day one. He worked as a high school science teacher, and his passion for knowledge rubbed off on me. Dad would bring home medical journals that his doctor friends had finished with, and I would pore over them fascinated by the human body, even before I could understand half the terminology. My childhood was relatively normal until I turned 11. That summer, I started experiencing unusual fatigue swelling around my eyes and frequent urination. At first, Mom dismissed it as me drinking too many sodas or staying up too late reading. But Dad noticed the changes and insisted on a doctor's visit. That appointment changed everything. Your son has chronic glomerulonephritis, the doctor told my parents as I sat there trying to pronounce the word in my head. It's a kidney condition that will require long-term management and possibly surgeries as he gets older. I remember my father's hand tightening around mine while my mother's face seemed to harden with something I couldn't quite identify at 11 years old. Looking back, I think that was the moment something shifted in her. My illness became an inconvenience in her carefully planned life. By that point, my sister Amanda was 9, already showing signs of being academically gifted. She brought home perfect report cards, won spelling bees, and played violin beautifully. While I spent more and more time at doctor's appointments, Mom spent more time at Amanda's recitals and academic competitions. Your sister has such potential, Mom would say within my earshot. We need to nurture her talents. The unspoken comparison hung in the air like a bad smell. Amanda had potential, I had problems. Dad tried his best to buffer the growing distance. He drove me to most of my appointments, sitting with me through long waits, explaining medical terms and never making me feel like I was a burden. He would bring medical books appropriate for my age, feeding my growing interest in medicine. You understand this stuff better than some of my students, he'd say proudly, as I explained kidney function to him from what I'd learned. You might make a fine doctor someday. My first surgery came when I was 14. My kidneys were deteriorating faster than medication could manage, and I needed a procedure to help maintain function. Mom came to the hospital for the pre-operation consultation and the day of surgery, but it was Dad who slept in the uncomfortable recliner beside my bed for 3 nights. Mom had responsibilities at home with Amanda. Those hospital stays, though frightening, sparked something in me. I watched the doctors work with fascination. Dr. Lawson, my nephrologist, noticed my interest and would take extra time to explain procedures and treatments. You ask better questions than most medical students, she told me once. That comment lit a fire in me that has never gone out. I decided then that I would become a surgeon. If I had to spend so much time in hospitals, I would make it count. Throughout high school, I pushed myself academically, despite regular absences for treatments. Dad helped me keep up with schoolwork, and I maintained a 4.0 GPA despite everything. When I brought home my perfect report card, Dad would make a big celebration of it. "That's my boy," he'd exclaim, putting it on the refrigerator like I was still in elementary school. Mom would glance at it and say, "That's nice," before returning to whatever of Amanda's accomplishments had her attention that day. By 16, I had developed a coping mechanism, achievement as validation. If I could just be successful enough, maybe Mom would see me as something other than a medical burden. I threw myself into academics, joining science clubs and entering medical science fairs. I won the state science competition with a project on kidney disease treatments, earning a small scholarship for college. Dad framed the certificate and hung it in our living room. Mom moved it to the hallway a week later. My condition continued to worsen throughout high school. The medications had side effects that made me gain weight and made my face puffy. Some kids called me Marshmallow Man, but I focused on my studies instead of their taunts. I had a small group of loyal friends who knew about my condition and didn't treat me differently. Dad became my emotional anchor. Every time I felt like giving up, he was there with encouragement and unwavering belief in me. "You're going to make a difference in this world, Nathan," he would tell me. "Your challenges are giving you compassion and understanding that will make you an extraordinary doctor someday." I clung to those words through the difficult days, through the medications that made me sick, through the procedures that left me in pain, and through my mother's growing indifference. I was building resilience I would need later, though I didn't know it then. By senior year, I had been accepted to several pre-med programs with scholarships. Despite my health challenges, my future was beginning to take shape in the direction of my dreams. Dad and I researched universities with good pre-med programs that also had excellent hospitals nearby for my continued treatment. What I didn't know was that the biggest challenge wasn't my kidneys. It was a betrayal that would shape the next decade of my life. Senior year was supposed to be a celebration of everything I had achieved, despite my health challenges. I had been accepted to the pre-med program at Boston University with a partial scholarship, and my kidney function had stabilized somewhat with the current treatment regimen. Dad and I were cautiously optimistic about the future. Then in April, just 2 months before graduation, everything crashed. What started as a mild fever quickly escalated. Within 48 hours, I was in the emergency room with dangerously high blood pressure and severe kidney pain. The tests confirmed what Dr. Lawson had warned might eventually happen. My kidneys were failing rapidly. "Nathan needs surgery immediately," Dr. Lawson told my parents in the hospital consultation room. I was present, but barely conscious due to the pain medication. "We need to place a permanent fistula for dialysis access and potentially do a procedure to save some kidney function. Without this, he will need a transplant much sooner." Through my medication haze, I heard my mother's response clearly. "But the timing is terrible. Amanda's high school graduation is next week, and there are all the celebrations and family coming in from out of town." Dr. Lawson's voice sharpened. "Mrs. Mitchell, I don't think you understand the severity of the situation. Nathan's health is at critical risk." "Surely it can wait a few days," my mother pressed. "Amanda has worked so hard for this moment." My father exploded. "Are you serious right now, Margaret? Our son could die." I had never heard my mild-mannered father raise his voice like that. The argument continued as I drifted in and out of consciousness, but one statement cut through the fog with crystal clarity. "Your sister's graduation is more important than your surgery," Mom said when she thought I was asleep. "Amanda deserves to have her moment, without this overshadowing everything." Those words were a knife that pierced deeper than any scalpel ever could. In that moment, I understood that in her eyes my existence was an inconvenience, my health problems an annoying distraction from the perfect family life she had envisioned with her star daughter. Dad's response was immediate and furious. "How dare you? How can you even compare the two? One is a ceremony that can be recorded, the other is our son's life." The surgery was scheduled for the day after Amanda's graduation, a compromise that Dr. Lawson reluctantly agreed to after additional medication temporarily stabilized my condition. The atmosphere at home during that week was toxic. Dad slept in my room to monitor my condition, barely speaking to Mom except when absolutely necessary. Amanda was caught in the middle. To her credit, she did visit me in the hospital before her graduation. "I told Mom I could skip the ceremony," she said quietly, sitting beside my bed, "or at least the party afterward." "Don't," I replied, too hurt and proud to accept the gesture. "Go enjoy your perfect day." She looked conflicted, but ultimately did as I said. Later, I would learn that Mom had convinced her that there was nothing she could do at the hospital anyway, that it would only ruin her special day for nothing. The day of Amanda's graduation, I lay alone in my hospital room. Dad had promised to attend the ceremony quickly and then spend the rest of the day with me. Mom didn't even call to check on me. On the bedside table sat my own graduation cap. I would not be attending my ceremony the following week. When Dad returned to the hospital that evening, his face was a thundercloud. Your mother wanted me to stay for the entire family dinner, he said, his voice tight with anger. I left after an hour. Your sister sent her love. I nodded, not trusting myself to speak. The betrayal was too fresh, too raw. The surgery the next day was complicated by my deteriorating condition. What should have been a 4-hour procedure stretched to 7, as the surgical team worked to create the fistula, while also trying to preserve my remaining kidney function. When I woke up, only Dad was there. Where's Mom? I asked, already knowing the answer. There's a brunch for Amanda, and the relatives, he said, not meeting my eyes. Post-surgery. I developed a serious infection that kept me hospitalized for 2 additional weeks. Dad took leave from work to stay with me. Mom visited twice briefly, always checking her watch and talking about what she was missing with Amanda. During those long hospital days, I made a decision that would alter the course of my life. Once I was discharged, I would cut ties with my mother and sister. The wound they had inflicted was too deep, the message too clear. I was less important, less valuable, less worthy of love and attention. Dad supported my decision, though I could see it broke his heart to see our family fractured. You need to do what's right for your healing, both physical and emotional, he told me. I'll always be here for you, no matter what. 3 months later, Dad helped me move into my dorm at Boston University. Mom and Amanda didn't come to say goodbye. By then, the divorce proceedings had already begun. Dad couldn't forgive Mom for her choices, and frankly, neither could I. As I unpacked my things in that tiny dorm room, I made a promise to myself I would never again allow anyone to make me feel like my existence was an inconvenience. I would build a life and career so successful that no one could dismiss me, especially not the mother who had chosen a ceremony over her son's health. College was both terrifying and liberating. For the first time, I was on my own, managing my medical condition while carrying a full course load of challenging pre-med classes. My dorm roommate Derek was a computer science major who didn't ask questions when I needed to take my numerous medications, or when I had to schedule my classes around dialysis appointments. Everyone's got their stuff, he said with a shrug, when I tentatively explained my condition. That simple acceptance was refreshing, after years of being treated as either fragile or inconvenient. Dad called me every other day at first, worried about how I was managing. We never spoke about Mom or Amanda directly, but he would occasionally let slip information. Your sister started at Northeastern, he mentioned once. Nursing program. The irony wasn't lost on me. Amanda, who couldn't be bothered to sit with her brother during a life-threatening medical crisis, wanted to be a nurse. I said nothing and changed the subject. Financially, things were tight. The divorce had stretched Dad's teacher's salary thin, and while my scholarship covered much of my tuition, I still needed money for medical expenses not covered by insurance. I took a job at the university library working 20 hours a week, despite my doctor's concerns about overexertion. You need rest between dialysis sessions, Dr. Harrison, my new nephrologist in Boston, warned me. What I need is to stay in school and pay for my medications, I replied. He reluctantly agreed to monitor me closely. Those first 2 years were a grueling test of endurance. I would go to classes, then to work, then to dialysis 3 times a week, then study until I couldn't keep my eyes open. But gradually I began to build a new life. I made friends in my science classes, serious, ambitious students who respected my drive and didn't pity my condition. Elena, a biochemistry major, became particularly important to me. She was brilliant, compassionate, and seemed to understand my need to prove myself. You're not defined by your kidneys or your family, she told me one night as we studied for organic chemistry. You're defined by what you do with the challenges you're given. Her words became another mantra that carried me forward. Elena, Derek, and a few other close friends became my chosen family. We celebrated holidays together when I couldn't or wouldn't go home, shared meals, and supported each other through the rigors of demanding science programs. I excelled academically, despite everything. By junior year, I was on the dean's list and had secured a research position in a nephrology lab. My professors began to take notice of my unusual combination of academic excellence and personal experience with kidney disease. Dr. Whitman, my cellular biology professor, became a crucial mentor. When I confided my dream of becoming a surgeon despite my health challenges, she didn't dismiss it. "Medicine needs doctors who understand illness from the inside," she said. "Your experience gives you insight that can't be taught in any classroom." With her guidance, I applied for a special medical school program at Massachusetts General that considered candidates with chronic health conditions who demonstrated exceptional academic ability. To my shock and joy, I was accepted with a full scholarship. When I called Dad with the news, he cried. "I always knew you could do it," he said, his voice thick with emotion. "I'm so damn proud of you, Nathan." Medical school was even more demanding than undergrad, but by then my health had stabilized somewhat. I had developed a routine for managing dialysis and medications that allowed me to function at a high level. I was still tired more often than my peers, still had days when the pain was almost unbearable, but I pushed through. In my second year of medical school, something unexpected happened. A compatible kidney donor was found. The transplant surgery was scheduled quickly, and this time Dad was there every step of the way. He took a month off work to help me recover afterward. The transplant changed everything. Though I would always need anti-rejection medications, my energy levels improved dramatically. For the first time since childhood, I could function without the constant fatigue and pain that had been my companions for so long. With my improved health, I threw myself even more deeply into my studies. I decided to specialize in pediatric surgery, wanting to help children facing medical challenges similar to what I had experienced. During my clinical rotations, I found I had a natural rapport with young patients. "You don't talk to us like we're stupid," one 12-year-old with leukemia told me. "The other doctors act like we can't understand anything." "I know exactly what that feels like," I told him. "When I was your age, I was in and out of hospitals too." That connection with patients, combined with my growing surgical skills, began to set me apart. My residents and attending physicians took notice. Dr. Kaplan, the chief of pediatric surgery, became another important mentor. "You have exceptional hands, Mitchell," he told me after watching me assist on a complex procedure. "But more importantly, you have exceptional empathy. That combination is rare and valuable." With Dr. Kaplan's recommendation, I secured a prestigious surgical residency at Boston Children's Hospital. The 5 years of residency were brutal. 100-hour weeks, sleepless nights, constant pressure. But I thrived under the challenges. My past struggles had prepared me well for the rigors of surgical training. Throughout these years, my contact with my mother and sister remained non-existent. Dad kept me minimally informed of major developments. Mom had moved to a smaller house after the divorce. Amanda had graduated from nursing school and was working at Massachusetts General, but I had no desire to reconnect. The wound from that betrayal had scarred over but never truly healed. I channeled that lingering pain into ambition, using it as fuel to push myself further and faster in my career. If I was honest with myself, part of my drive was still about proving my worth, showing my mother how wrong she had been to dismiss me. My personal life took a back seat to my career. I dated occasionally, but most relationships fizzled quickly. I had built walls around my heart that few could penetrate. One woman, Stephanie, a pediatric oncologist, came close. We were engaged briefly during my chief resident year, but she eventually ended things. "You're never going to let anyone completely in," she said sadly as she returned the ring. "Part of you is always holding back, waiting for the other person to let you down." She wasn't wrong. Trust didn't come easily to me anymore. The few people I did trust completely, Dad, Elena, who had remained a close friend, and a couple of fellow surgeons, had earned that trust over many years. By 30, I had completed my residency and a fellowship in pediatric transplant surgery. My reputation as a skilled surgeon with exceptional bedside manner, particularly with children, had begun to spread beyond Boston. I published several papers on innovative techniques for pediatric kidney transplants, drawing on both my medical training and personal experience. The crowning achievement came when I was 32. Boston Memorial Hospital, a leading transplant center, offered me the position of chief of surgery, the youngest in the hospital's history. The role would allow me to shape surgical protocols, mentor young surgeons, and continue my own groundbreaking work. When I called Dad with the news, his pride was palpable even through the phone. "You did it, Nathan," he said. "Against every obstacle, you did it." I moved to a new apartment closer to Boston Memorial, ready for this next chapter. What I didn't know was that fate had a strange twist waiting for me, one that would force me to confront the past I had spent 14 years trying to leave behind. The morning of my first official orientation as chief of surgery, I arrived at the hospital at 6 a.m. to prepare. My new office still felt surreal, spacious with large windows overlooking the Boston skyline, my name on the door with chief of surgery beneath it. I spent an hour reviewing the files of the new surgical staff and nursing leadership team I would be meeting today. Halfway through the stack, a name jumped out at me like it was printed in neon: Amanda Mitchell. My coffee cup froze halfway to my lips. It had to be a coincidence. Mitchell was a common enough surname. But as I quickly scanned the file, the details confirmed my worst fear: graduated from Northeastern Nursing Program, previous experience at Massachusetts General, specialized in surgical nursing. It was her. My sister was joining my hospital as the new surgical nursing director. For a moment I considered calling HR to have her application revoked, but I knew that would be both unethical and legally problematic. Besides, it would mean acknowledging our connection. No, I would handle this professionally. Boston Memorial was a large hospital. Perhaps our paths wouldn't cross often. At 9 a.m. sharp, I entered the conference room where 30 new staff members waited for orientation. I was in full chief of surgery mode, confident, authoritative, respected. My custom-tailored suit and the gravitas I had cultivated over years of leading surgical teams gave no hint of the anxious teenager I had once been. "Good morning," I began. "I am Dr. Nathan Mitchell, Chief of Surgery at Boston Memorial. Welcome to what I believe is the finest surgical department on the East Coast." As I continued my welcome speech, my eyes scanned the room and locked with an all-too-familiar pair. Amanda sat in the second row, her face drained of color. She looked different. 14 years will do that. But the resemblance to our mother was stronger now. Her blonde hair cut in a professional bob, her posture perfect as always. The moment stretched between us, like an eternity, though in reality, it was probably only a second or two. I continued speaking without missing a beat, but the room had gone notably quiet, as people sensed the sudden tension. "You'll find that we maintain exceptionally high standards here," I continued, breaking eye contact with Amanda and addressing the entire room again. "We expect excellence, dedication, and absolute professionalism from every member of our team." I emphasized that last word slightly, a message intended for one person in particular. Throughout the 3-hour orientation, I maintained perfect composure, discussing surgical protocols, hospital policies, and my expectations for the department. I didn't single Amanda out or give any indication that I knew her. When the session ended, people approached me with questions and introductions. I could see Amanda hovering at the edge of the group, clearly wanting to speak with me. When the crowd thinned, she finally approached. "Dr. Mitchell," she said formally, extending her hand. "Amanda Mitchell, the new surgical nursing director. It's a pleasure to meet you." So that was how she wanted to play it. Fine by me. "Miss Mitchell," I replied, shaking her hand briefly. "Welcome to Boston Memorial. I trust you'll find everything in order in the surgical nursing department. If you have any questions about protocols, my assistant can direct you to the appropriate resources." Her eyes searched mine for any hint of recognition or emotion, but I had perfected my professional mask years ago. She looked like she wanted to say more, but I turned to answer a question from another new hire, effectively dismissing her. As I walked back to my office afterward, Dr. Sarah Levine, a cardiothoracic surgeon who had been at Boston Memorial for 20 years, fell into step beside me. So she said casually, "That was interesting." What was I kept my voice neutral. "Oh, come on, Nathan. The temperature dropped 20 degrees when you and the new nursing director made eye contact. Same last name, too. Relative." I sighed. Sarah was too perceptive and too valued a colleague to lie to. "Sister," I admitted once we were in the privacy of my office, "we haven't spoken in 14 years. Sarah whistled low. "That's going to make department meetings awkward." "It won't be an issue," I said firmly. "I'm a professional. I can work with anyone." "Of course you can," she agreed. "But family complications have a way of seeping into professional spaces, no matter how thick the walls we build." Her words proved prophetic sooner than I expected. That afternoon, I received an email from Amanda requesting a meeting to discuss surgical nursing protocols. I knew it was an excuse, but I couldn't refuse a meeting with a department head without raising questions. I scheduled it for the end of the day, giving myself time to prepare emotionally. At 5:30 p.m., my assistant left for the day, and at 5:45 there was a knock on my office door. "Come in," I called, not looking up from the surgical journal I was pretending to read. Amanda entered, closing the door behind her. For a long moment, neither of us spoke. I finally looked up, keeping my expression neutral. "Have a seat, Miss Mitchell," I said, gesturing to the chair across from my desk. "Nathan," she said softly, "this is crazy. Can we please talk like normal people, like family?" "We have a professional relationship, Miss Mitchell," I replied coolly. "I'm your superior in the hospital hierarchy. That's the extent of our connection." She flinched slightly at my tone, but didn't back down. "I had no idea you worked here when I applied," she said. "I just knew Boston Memorial had an excellent surgical department. Finding out you were the chief of surgery well, it was a shock. As it was for me to see your name on the new hire list, I acknowledged. But what's done is done. I expect you to maintain absolute professionalism. Our personal history has no place in this hospital." "So that's it." Her voice rose slightly. 14 years of silence, and now we're just going to pretend we don't know each other except as colleagues. "Would you prefer I have your transfer request processed?" I asked coldly. "Because I can arrange that if you find the situation untenable." She looked at me for a long moment, hurt evident in her eyes. "You've changed," she finally said. Yes, I agreed. "I have. Now, did you actually have questions about surgical nursing protocols, or was this meeting merely a pretext?" Amanda straightened in her chair, visibly composing herself. "Actually, I do have legitimate questions about the transplant protocols. They differ somewhat from what we used at Mass General." "Fine," I said, pulling out the relevant documentation. "Let's discuss the protocols." For the next 30 minutes, we had a perfectly professional conversation about surgical procedures and nursing responsibilities. Anyone observing would have seen two colleagues discussing work matters with no hint of the emotional hurricane beneath the surface. As she gathered her notes to leave, Amanda paused at the door. "For what it's worth, Nathan," she said quietly, "I've spent 14 years regretting what happened. I hope someday you'll let me explain my side of things." I didn't respond, and after a moment she left. Once alone, I let out a long breath and ran my hands over my face. I had thought this chapter of my life was closed, the book shelved away where it couldn't hurt me anymore. Now it had been pulled down, dusted off, and reopened to the most painful pages. That night I called Dad for the first time in weeks. "Amanda's working at my hospital," I said, without preamble when he answered. There was a pause. "I know," he finally said. "She told me she had applied there but didn't know you were the chief of surgery until she was already hired." "Did you know I couldn't keep the accusation from my voice?" "No," Dad said firmly. "Nathan, I would never have kept that from you. You know that." I did know that. Dad had never been anything but honest and supportive. "What am I supposed to do?" I asked, feeling suddenly like that 18-year-old boy again, seeking my father's guidance. "What you always do," he replied simply. "Your best. You're a professional, Nathan. You can handle this." After hanging up, I stood at my apartment window looking out at the Boston skyline. Dad was right. I could handle this professionally. What I wasn't sure about was handling it emotionally. Seeing Amanda had ripped open wounds I thought had long since scarred over. The coming months would test both my professional composure and my emotional resilience in ways I couldn't yet imagine. For 3 weeks, Amanda and I maintained our professional facade. We interacted when necessary in meetings and during surgical procedures, always cordial, always appropriate. If the staff noticed anything unusual, they were professional enough not to mention it directly, though I occasionally caught curious glances when we were in the same room. I thought I had the situation under control until a particularly challenging case came into the ER, a 10-year-old boy with severe kidney trauma after a car accident. I was called in to perform emergency surgery, and Amanda was the nursing director on duty. We worked side by side for 7 hours, fighting to save the boy's kidney and ultimately his life. The case was too complex, too demanding for any personal tensions to interfere. We functioned as a seamless team, anticipating each other's needs, communicating efficiently. When we finally stabilized the child and moved him to recovery, Amanda and I found ourselves alone in the surgical scrub room, the adrenaline of the successful surgery still coursing through our veins. "You're an exceptional surgeon," she said quietly as we washed up. "That boy would have lost his kidney in less skilled hands." "You're a good surgical nurse," I replied the compliment, escaping before I could stop it. "Your team was well prepared." A small, sad smile touched her lips. "We always did work well together as kids. Remember that science fair project in 5th grade, the volcano that actually worked?" The unexpected memory caught me off guard. For a brief moment I saw not the nursing director but the little sister who had once followed me around adoringly before our mother's favoritism poisoned everything. "That was a long time ago," I said, shutting down the moment of vulnerability. I dried my hands and left without another word. That night I couldn't sleep. The surgery, the brief connection with Amanda, the memories it had stirred, all of it left me restless and unsettled. Around midnight I gave up on sleep and went into the hospital to check on our young patient. I was reviewing his chart at the nurse's station when I heard footsteps. Looking up, I saw Amanda approaching, still in her scrubs. "Couldn't sleep either?" she asked. I shook my head. "Wanted to check his kidney function numbers." "They're improving," she said. I just looked in on him. "He's stable." We stood in awkward silence for a moment. The hospital was quiet at this hour, just the soft beeping of monitors and the occasional voice over the intercom breaking the stillness. Nathan Amanda finally said, her voice barely above a whisper. "We need to talk, really talk. Not as chief of surgery and nursing director, as brother and sister." I should have refused. I should have maintained the professional boundary I had so carefully constructed. But the exhaustion of the day, the emotional toll of the past few weeks, perhaps even the success of saving that boy's kidney, something made me nod. "My office," I said. 5 minutes. In the privacy of my office, with the door closed and the late hour ensuring no interruptions, 14 years of silence finally broke open. "I've tried to contact you," Amanda began. "So many times over the years. Letters, emails, messages through Dad. I never received anything," I said flatly. "I know that now," she replied. "Mom intercepted everything. The letters were returned, the emails blocked. I didn't find out until years later, when I was going through her things and found a box with all my unopened letters to you." I stared at her, trying to process this information. Why would she do that? "Because she couldn't face what she had done," Amanda said, her eyes filling with tears. "And because she knew I was angry with her for how she treated you. She was afraid I would take your side completely if we remained in contact." "So you did recognize how wrong it was," I said. A question and an accusation wrapped into one. "Yes," Amanda admitted. "Not right away. I was a self-centered teenager and Mom was very good at manipulating the narrative. But by college I had perspective. I tried to find you to apologize, but you had cut all ties." I leaned back in my chair, studying my sister's face. She looked genuinely distressed, but 14 years of hurt and anger couldn't be erased by one conversation. "Even if what you're saying is true," I said carefully, "it doesn't change what happened. You were there. You could have stood up for me." "I know," she whispered. "That's my greatest regret. I was 16, caught between Mom's manipulation and my own selfish desires to have a perfect graduation. By the time I realized how deeply wrong it was, you were gone." She reached into her bag and pulled out a manila envelope. "These are some of the letters I wrote you over the years. Dad gave me your college address, but they always came back. Now I know why." I took the envelope but didn't open it. "Why are you telling me this now? What do you want from me, Amanda?" She took a deep breath. "There's something else you need to know. The real reason I came to Boston Memorial." She paused, seeming to gather her courage. "Mom is dying. Pancreatic cancer, stage 4. She has maybe 6 months." The news hit me like a physical blow. Despite everything, despite the years of anger and hurt, hearing that the woman who had given me life was dying stirred complex emotions I wasn't prepared for. "I'm sorry to hear that," I said stiffly. "She wants to see you," Amanda continued. "To apologize before it's too late. She's been in therapy for years, Nathan. She recognizes how terribly she failed you. I stood up abruptly, walking to the window. So that's why you're here. To play messenger and peacemaker. Partly, Amanda admitted. But also because I needed to make things right between us regardless of Mom. I became a nurse because of you. Did you know that? Watching what you went through, seeing how the good nurses made such a difference, it shaped my entire career path. I turned to look at her, truly seeing her for the first time since she had walked into that orientation. She wasn't the spoiled teenager anymore, nor was she our mother's puppet. She was a grown woman, accomplished in her own right, carrying her own regrets and trying to make amends. I need time to process all this, I finally said. 14 years of anger doesn't disappear in one conversation. I understand, she said, standing to leave. But Nathan, we work together now. Could we at least try to build some kind of relationship? Even if you never want to see Mom again, could you consider forgiving me? I didn't have an answer for her then. As she left my office, I stood holding the envelope of letters, wondering if reading them would heal old wounds or simply reopen them. That night I called Dad again. Did you know Mom is dying? I asked. Yes, he said heavily. Amanda told me a few months ago. And you didn't tell me. I couldn't keep the hurt from my voice. I was waiting for the right time, Dad sighed. And truthfully, I wasn't sure you would want to know. Your mother hurt you deeply, Nathan. I've never minimized that or asked you to forgive her. Amanda says Mom wants to see me. That's your decision, Dad said. Whatever you choose, I'll support you. Just make sure it's what you really want, not what you think you should do or what others expect. After we hung up, I opened the envelope Amanda had given me. Inside were dozens of letters spanning 14 years, from the barely coherent apologies of a guilt-ridden teenager to the measured reflections of a woman trying to understand her role in a family tragedy. Reading them into the early morning hours, I began to see a different perspective on the past we shared. I didn't know if I could forgive either Amanda or our mother, but for the first time in 14 years I was willing to consider the possibility that there was more to the story than my pain and their betrayal. Over the next several months, Amanda and I settled into an uneasy truce. Our professional interactions became less strained, though still formal. I hadn't decided about meeting with our mother, and Amanda didn't push, though I knew time was growing short. What I hadn't anticipated was Amanda's exceptional skill as a surgical nursing director. She implemented several innovative protocols that improved patient outcomes and streamlined preoperative procedures. Her staff respected her, and other department heads frequently praised her work in administrative meetings. A part of me, a petty wounded part I wasn't proud of, felt threatened by her success. After all, I had defined myself by my achievements, by proving I was worthy despite my mother's rejection. Seeing Amanda excel in the same hospital stirred complicated feelings of competition and resentment. Things came to a head during a departmental review meeting. Amanda presented a new recovery protocol for pediatric transplant patients, my specialty. That data showed reduced complication rates by 15%. This is excellent work, Miss Mitchell, Dr. Levine commented. Dr. Mitchell, have you reviewed these findings? This could significantly impact your pediatric transplant outcomes. All eyes turned to me. I had reviewed Amanda's protocol and knew it was sound, possibly even groundbreaking. Professional integrity demanded I acknowledge this, regardless of personal feelings. I have, I said evenly. The protocol is well designed and the data compelling. I recommend we implement it immediately in the pediatric transplant unit. Amanda looked genuinely surprised by my endorsement. After the meeting, she approached me in the hallway. Thank you for supporting the protocol, she said. I wasn't sure you would. I'm a doctor first, I replied. Personal feelings don't factor into medical decisions. She studied me for a moment. Would you be willing to collaborate on the implementation? Your expertise would be invaluable in fine-tuning the protocol for specific transplant scenarios. The request was reasonable and professionally appropriate. Refusing would look petty and unprofessional. Fine, I agreed. Have your team send over the detailed protocol and we'll schedule a working session next week. That collaboration, reluctant as it was on my part, became a turning point. Working together on the protocol, Amanda and I found ourselves slipping into a rhythm that felt oddly familiar, the same complementary dynamic we had shown during that emergency surgery, the same synergy we had once had as children tackling science projects together. One evening as we were finalizing the protocol in my office, Amanda mentioned a challenging case, a 7-year-old girl named Lily with kidney disease remarkably similar to what I had experienced as a child. "Her labs look a lot like yours did at that age," Amanda said, sliding the chart across the desk to me. "The attending is recommending standard treatment, but I wonder if there might be alternatives." I reviewed the chart carefully. "The attending's recommendation is textbook," I said. "But in my experience, both personal and professional, there are more aggressive approaches that could preserve kidney function longer." For the next hour, we discussed Lily's case, drawing on both current medical literature and my personal history with similar treatments. It was the first time I had ever openly discussed my medical journey with Amanda as an adult. She listened attentively, asking insightful questions that showed both her nursing expertise and genuine interest in understanding what I had experienced. "You would have been an exceptional doctor," I found myself saying as we wrapped up the discussion. "I'm happy being an exceptional nurse," she replied with a small smile. "Besides, there's already one brilliant Dr. Mitchell in the family." The casual acknowledgement of our family connection, spoken without tension or awkwardness, caught me off guard. Even more surprising was that it didn't trigger my usual defensive response. The next day I went to see Lily myself and recommended the alternative treatment approach to her attending physician. When the doctor asked about my personal interest in the case, I found myself saying something I had never said to a colleague before. I had a similar condition as a child. Sometimes personal experience offers insights that textbooks don't cover. 2 weeks later, Dad came to Boston for a visit. When he suggested dinner, I impulsively asked if Amanda could join us. His surprise and happiness were evident, though he tried to play it cool. "Sure, if you're comfortable with that," he said carefully. The dinner was awkward at first, the three of us navigating unfamiliar, emotional territory. But as the meal progressed, the conversation flowed more naturally. We discussed hospital politics, Dad's retirement plans, and eventually, cautiously, some shared memories from before the fracture in our family. "Remember that camping trip when Nathan got poison ivy so bad his eyes swelled shut?" Dad recalled laughing. "And Amanda had to lead him around by the hand for 2 days. "I was a terrible guide," Amanda admitted, smiling. "I kept letting him walk into things. On purpose, as I recall, I added surprising myself by joining the reminiscence without bitterness. By dessert, something had shifted. The air between us felt lighter, the weight of 14 years of silence a little less crushing. As we were leaving the restaurant, Dad pulled me aside while Amanda was in the restroom. "I haven't seen you this relaxed in years," he said quietly. "It's good to see you two talking again." "We're not fully reconciled," I cautioned him. "Just figuring things out." "That's all anyone can ask," he replied. The tentative reconnection with Amanda affected my work in unexpected ways. I found myself more open with colleagues about my medical history, more willing to share the personal experiences that informed my surgical approach. This openness, in turn, helped me connect more deeply with patients and their families. Then came the case that truly changed everything. A teenage boy, Ryan, was admitted with acute kidney failure following a sports injury that had exacerbated an underlying condition. His situation was critical, requiring immediate surgical intervention. When I reviewed his case, I saw my own medical history reflected back at me. The same initial diagnosis at a similar age, the same deterioration pattern, even similar lab values. His mother was a single parent, clearly overwhelmed by the medical crisis, but fiercely determined to support her son. I requested Amanda as the surgical nursing director for the case. When she reviewed the file, she immediately understood why. "He's you," she said simply. 14 years ago. The surgery was high risk, with complications arising midway through that required split-second decisions. Amanda and I worked in perfect synchronization, communicating sometimes with just a look or a gesture. When Ryan's blood pressure dropped dangerously, Amanda anticipated my needs before I could voice them, her team responding with perfect precision to stabilize the patient. After 11 grueling hours, we succeeded in saving not only Ryan's life but also partial function in both kidneys, an outcome that had seemed impossible when we began. In the surgical recovery room, exhausted but exhilarated, Amanda and I exchanged a look of shared triumph that transcended our professional roles and complicated history. In that moment, we weren't chief of surgery and nursing director, or estranged siblings with 14 years of silence between us. We were simply two people who had worked together to save a young life. "We make a good team," Amanda said quietly, as we updated Ryan's mother on his condition. "We do," I acknowledged, and for the first time the admission didn't feel like a concession or a weakness. That night, as I was leaving the hospital, Amanda caught up with me in the parking garage. "Nathan," she said, hesitating before continuing, "Mom asked about you again yesterday. The doctors have revised their estimate. 3 months, maybe less." I stood silent for a long moment, keys in hand, the weight of the decision pressing on me. "I'll think about it," I finally said. And for the first time, I meant it. 2 weeks after Ryan's surgery, I found myself driving to a hospice facility in a quiet suburb outside Boston. I had called Amanda the previous night to tell her my decision, and she had offered to accompany me, but this was something I needed to do alone first. The facility was pleasant enough with sunny rooms and attentive staff, but nothing could disguise its purpose as a place where people came to die with dignity. A nurse directed me to room 214, and for several minutes I stood outside the door gathering my courage. Finally, I knocked softly and entered. The woman in the bed barely resembled the mother I remembered. Margaret Mitchell had once been an imposing figure, always perfectly coiffed makeup, immaculate posture, rigid with a kind of contained energy. The person before me now was diminished, her once blonde hair thin and gray, her face gaunt, her body frail beneath the blankets. Her eyes widened when she saw me, a trembling hand rising to her mouth. "Nathan," she whispered, "you came." I moved to the chair beside her bed, maintaining some distance. "Amanda told me about your diagnosis," I said, my voice carefully neutral. I thought, "I should come." For a long moment she just looked at me, tears filling her eyes. "You look so much like your father," she finally said. "Strong, dignified. Dad taught me what it means to be a good man," I replied, the implication clear in my tone. She nodded, accepting the subtle rebuke. "He was always the better parent, the better person, really." She paused, struggling to find words. "Nathan, I know nothing I say can undo what I did. The way I favored Amanda, the cruel choices I made, especially about your surgery." Hearing her acknowledge it directly without excuses loosened something tight in my chest. For 14 years I had carried the weight of that betrayal, the words that had cut so deeply. "Your sister's graduation is more important than your surgery." Why, I asked the question that had haunted me for years. Why did you make that choice? She looked away, her hands fidgeting with the edge of her blanket. "I've spent years in therapy trying to understand it myself," she said quietly. "Some of it was about control. Your illness was something I couldn't fix, couldn't manage. It terrified me, and instead of facing that fear, I turned away from it. From you." She met my eyes again. "And some of it was my own inadequacy." Amanda was easy to parent. She followed rules, met expectations. You were challenging, brilliant, complicated, dealing with adult problems as a child. I didn't know how to be what you needed. "So you decided not to try at all," I said, unable to keep the edge from my voice. "Yes," she admitted. "It was cruel and inexcusable. When your father left me, it was a wake-up call. I realized I had destroyed our family with my choices." She reached for a glass of water, her hand shaking. I found myself automatically helping her, steadying the glass, a doctor's instinct to assist. "Thank you," she murmured. "Amanda tells me you're a brilliant surgeon, chief of surgery at Boston Memorial, and you work with children who have conditions like yours." "I do. That seems fitting. Taking your pain and using it to help others." She paused. "I'm not asking for forgiveness, Nathan. I don't deserve it, and I know it's too much to expect. I just wanted a chance to tell you that I recognize the harm I caused, that I'm deeply sorry for it, and that I have always loved you even when I failed completely at showing it." I sat in silence, absorbing her words. The anger that had fueled me for so long felt different now, faced with this frail woman acknowledging her failures. It didn't disappear. 14 years of hurt couldn't be erased in one conversation, but it shifted, becoming something less consuming. "I can't promise forgiveness," I finally said, "but I can promise that I'll try to let go of some of the anger. It hasn't served me well carrying it all these years." Relief washed over her face. "That's more than I hoped for," she said softly. "Thank you for coming, Nathan. It means everything to see the man you've become despite my failings." I stayed for another hour. Our conversation was tentative, navigating years of absence and hurt, but there were moments of genuine connection. She asked about my work, listened attentively to descriptions of challenging surgeries, expressed pride in my accomplishments that felt sincere. Before leaving, I told her I would return, perhaps with Amanda next time. It wasn't full reconciliation, but it was a beginning. Over the next 2 months, I visited regularly, sometimes with Amanda, sometimes alone. Each visit built a fragile bridge across the chasm of our past. I learned things about my mother I had never known. Her own difficult childhood, her struggles with anxiety and depression that had gone untreated for decades, her regrets that extended far beyond her treatment of me. During one visit, when she was having a good day, she asked about my kidney transplant. "Amanda told me you received a transplant in medical school," she said. "That must have been life-changing." "It was," I replied, "though I still take anti-rejection medications and always will." She was quiet for a moment. "An apt metaphor, perhaps," she said thoughtfully. "Even when we receive something life-saving, we must work to not reject it." The insight surprised me, and I found myself nodding in agreement. As her condition deteriorated, our conversations became less about the past and more about simple presence. I would sit with her, sometimes reading aloud from books she enjoyed, sometimes just keeping her company as she drifted in and out of sleep. Amanda and I often coordinated our visits, developing a schedule that ensured one of us was there regularly. One afternoon, after a particularly peaceful visit with our mother, Amanda and I went for coffee in the hospice garden. "Thank you for giving her this chance," Amanda said. "It's meant everything to her." "I did it as much for myself," I admitted. "And for you too. Carrying that anger was exhausting." She smiled. "Either way, it's been healing. For all of us." Our mother passed away peacefully 3 months after my first visit. Dad attended the small funeral, standing supportively beside Amanda and me as we received condolences from the few friends and extended family who came. His presence there, the ex-husband supporting his children through the loss of the woman who had hurt them all, spoke volumes about his character. In the months that followed, Amanda and I continued to build our relationship, both professional and personal. We established a weekly dinner tradition, sometimes joined by Dad when he visited from New Hampshire. During these meals, we gradually filled in the 14-year gap in our knowledge of each other's lives. I learned about Amanda's own struggles, living under our mother's excessive expectations, her failed marriage, to a controlling man who had reminded her too much of Mom, her journey through therapy, to understand her role in our family's dysfunction. She learned about my medical challenges, my friendships, my brief engagement, and my ambitions for the future of pediatric surgery. At work, our professional partnership flourished. The protocol we had developed together was yielding impressive results, drawing attention from other hospitals. We were invited to co-present at a major medical conference, our complementary expertise creating a compelling presentation that received considerable acclaim. One evening, after a particularly successful surgery on a child with a complex kidney condition, Amanda suggested an idea that would change both our lives. "We should start a foundation," she said as we reviewed post-operative notes, "for children with kidney disease, combining cutting-edge medical care with support for the whole family." The idea resonated immediately, a foundation that treats not just the medical condition but the family dynamics that are affected by chronic childhood illness. I elaborated, thinking of my own experience. "Exactly," Amanda nodded, enthusiastically. "We've lived both sides of it, the medical challenges and the family strain. We could make a real difference." Within 6 months, the Mitchell Foundation for Pediatric Kidney Health was established, funded initially by a portion of our mother's estate. a fitting use for the money, transforming the legacy of family pain into something healing, hopeful. The foundation work brought Amanda and me even closer, our shared purpose, healing old wounds in ways therapy alone never could. Dad joined the foundation board, contributing his educator's perspective on supporting children through medical challenges. My personal life began to flourish alongside my professional success. I started dating Dr. Rachel Chen, a pediatric psychologist who worked with our foundation. Her understanding of childhood trauma and family dynamics helped me continue my own healing journey. For the first time, I found myself able to truly open up to someone about all aspects of my past without fear of judgment or abandonment. 1 year after our mother's passing, Amanda, Dad, and I scattered her ashes in a garden overlooking the ocean, her favorite place. The ceremony was brief but meaningful, an acknowledgement of a complicated relationship that had caused deep pain but ultimately led to growth and healing. "She would be proud of what you two have created together," Dad said, as we watched the waves afterward. "Not that her pride should be your motivation," he added quickly. "You've built something extraordinary on your own terms." "Not entirely on our own," I replied, putting an arm around his shoulders. "We had an excellent example of what true parental support looks like." Later that evening, sitting on my apartment balcony with Amanda watching the Boston skyline glitter against the night sky, I reflected on the journey that had brought us here. "Do you ever think about how different things might have been?" she asked. "If Mom had made different choices back then." Sometimes I admitted, "But then I might not have become a surgeon. You might not have become a nurse. We wouldn't have the foundation. Some good has come from the pain, as hard as that is to reconcile." She nodded thoughtfully. "I've learned that healing doesn't mean forgetting or excusing what happened. It means finding a way to carry it that doesn't destroy you. Maybe even finding a way to transform it into something meaningful." "Exactly," I agreed. "And understanding that forgiveness isn't a single moment, but a process. Some days I still feel angry about what happened. Other days I feel compassion for Mom and the struggles she never overcame. Both can be true simultaneously." As we sat in companionable silence, I thought about the 18-year-old boy in that hospital bed, hearing those devastating words from his mother, feeling abandoned and worthless. I wished I could tell him that though the road ahead would be difficult, it would eventually lead to a place of purpose, success, and even healing. That the wound would never fully disappear, but it would become part of a larger, richer life story. The journey from betrayal to healing had been long and painful, but sitting there with my sister, I felt a sense of peace I had not thought possible. Not because the past had been erased, or because all hurts had been perfectly resolved, but because I had finally learned to carry my history without being defined by it. If you've ever experienced family betrayal or felt invisible in your own home, I hope my story offers some comfort. The path to healing isn't straight or simple, but it is possible. Sometimes the deepest wounds lead to the most profound growth. Has a family member ever betrayed your trust? And how did you handle it? Share your story in the comments below. And if this journey resonated with you, please hit that subscribe button and join our community of healing and growth. Remember, your worth isn't determined by how others treat you, but by the strength and compassion you find within yourself. Thank you for listening, and I'll see you in the next video.